is a critical turning point in this pandemic. Starting tomorrow, all Pennsylvanians ages 16 and older will be eligible to schedule a vaccine appointment. We're also launching the first statewide mobile vaccination and education tour to help reach people where they are. Now, all adult Pennsylvanians who want a vaccine can get one, and mobile units will provide another vaccination opportunity. Pennsylvania continues to make progress in our vaccination efforts, as indicated by the latest numbers in the state. Vaccine providers in Pennsylvania administered more than 6.4 million doses. That puts Pennsylvania 11th among the 50 states for first dose vaccinations. So far, more than 39% of the state's population has received at least one dose. Over the past 7 days, providers in Pennsylvania have administered an average of 87,000 doses per day. This week, Pennsylvania is receiving 296,620 first doses of vaccine from the federal government. Throughout the vaccine rollout, we have listened to residents and local leaders who were frustrated when there was not enough of vaccine available for their communities. It's a good sign that demand for the vaccine remains high here in Pennsylvania, because the more people who are vaccinated means the faster we can stop the virus. As more vaccine is becoming available, we are now able to expand eligibility and partner with Latino Connection to bring vaccines to more communities. In August 2020, we held an event to announce the COVID-19 testing mobile unit tour with Latino Connection. Today, we are proud to announce that Latino Connection will utilize their mobile units to host the first statewide COVID-19 vaccination and education tour across the Commonwealth. Similar to the testing initiative, the vaccination tour stops will be in minority and underserved communities who otherwise may have not had easy access to getting the COVID-19 vaccine. This speaks to the department's efforts to ensure equitable and distribution of vaccine for all. The education component of this tour is also important because it's through education that more individuals that have questions will be able to better understand how the COVID-19 vaccines were developed on such an expedited timeline. The vaccines that are available now have made it through extensive clinical trials to determine their safety and their effectiveness. The clinical trials were conducted according to the rigorous standards set forth by the federal government, and only those vaccines that have made it through the tough federal standards are available today for use in the United States. We encourage Pennsylvanians to get the first vaccine that is available to them so we can quickly and efficiently vaccinate everyone who wants it. It's important to remember that tens of millions of people in the United States have already received their COVID-19 vaccines. Learning about the process will help some individuals become more comfortable with the importance of getting the COVID-19 vaccine. They'll also have a better understanding of how it protects themselves, their families and friends, and those that they may come in contact with. While we are here today, I just want to take the moment to reiterate that COVID-19 vaccines are safe, they are effective, and we, alongside the Latino Connection, are working to make sure everyone has accurate information to make an informed decision. Stopping a pandemic requires the use of all tools available. We know that these tools include containing the virus through testing and contact tracing and conducting case investigations. It also requires us to be mitigating the spread through masking and practicing good hygiene. And finally, by healing those who have been severely infected and protecting everyone in Pennsylvania, infected or not, with the vaccine. We recommend getting tested for COVID-19 if you come into contact with an infected individual or if you are experiencing symptoms. The symptoms and testing page on our website is up to date with hundreds of locations across the Commonwealth offering COVID-19 testing. We also list information about free testing clinics. In closing, please continue to do your part to fight COVID-19. First, get vaccinated. Then, Continue that personal accountability measures that we've all been embarking on for the last year, including wearing a mask, social distancing, getting tested if necessary, and washing your hands to help reduce your chance of being exposed to the virus or spreading it to others. Together, COVID-19 vaccination and following the CDC's recommendations to protect yourself and others will offer the best protection from COVID-19 vaccine. At this time, I am honored to introduce George Fernandez, the founder and CEO of the Latino Connection. George?
Thank you, Secretary Beam. It's a pleasure to have you. Good afternoon. Buenas tardes. Thank you so much to Beacon Clinic for hosting us today in their beautiful home. It's a pleasure to be here. Thank you so much, Deb, and to your amazing volunteers. I met an amazing volunteer today who is 90 years old, and she was so excited to be here today. Really, really amazing. Thank you again, Deb. Words cannot fully express how grateful and excited I am to be here today, representing Latino Connection and introducing Pennsylvania's first COVID-19 vaccination mobile unit. Thank you again, Secretary Beam. The progress that has been made by our nation, our Commonwealth, and our community within just 1 year is astounding. 1 year ago, our world as we knew it was shut down. Businesses and schools were closed. There was limited access to basic necessities, and we truly lived in fear. Today marks a new day, and one that we could have only prayed for 1 year ago. Today and every day forward, people have increasing access to COVID-19 vaccinations, and the milestone we mark here is that these vaccinations are now being delivered into the hearts of communities where they are most needed. The unfortunate reality is that the suffering of our most vulnerable and underserved populations has risen to a whole new level due to COVID-19. And it's time we stop the spread of the disease in its tracks. Latino Connection feels very passionately that in order to solve healthcare inequality and reach our vulnerable and underserved communities, we need to meet our people where they are. Through this initiative, we are delivering COVID-19 vaccinations to easily accessible locations in areas where they are needed the most, and our vehicle for accomplishing this is Kate. You may know Kate from the hundreds of COVID-19 testing events that she completed last year. This mobile unit delivered over the last 9 months over 20,000 pieces of literature for education, and we're really happy that it has graduated to become Pennsylvania's first mobile vaccination unit. Over the coming months, Kate is equipped to travel across the Commonwealth, providing COVID-19 vaccinations and education to everyone, regardless of income or health insurance. Today marks only the beginning, and again, this is only possible through our partnership with the Pennsylvania Department of Health. Starting next week, those who want a vaccine can visit www.katemobileunit.com to pre-register for an upcoming vaccination event. A total of 120 vaccination events will take place across the Commonwealth over the coming months. Additionally, 100 educational tabletop events will take place in corner stores and bodegas in key locations where individuals who do not have access to the internet or who are in need of assistance will be able to pre-register for a vaccination event in person. There will also be educational materials provided in both English, Spanish, and other languages. Most importantly, I want to recognize all of our community partners, including the Department of Health, Highmark Blue Shield, and the Independence Blue Cross Foundation, who have generously stepped up forward to ignite this paramount initiative. I wish to express my deepest gratitude to these partners for selecting Latino Connection to lead this mission. You share my vision for helping our underserved communities in a time when they need it the most. The impact of your generosity will not be forgotten, especially by those whose lives are changed as a result. I encourage everyone who wants a COVID-19 vaccination to utilize the many resources like Kate to stay safe, informed, and protected so that we can put an end to the fear and suffering caused by COVID-19. Again, please visit that website. Starting next week, you'll be able to pre-register. It's www.katemobileunit.com. And next, I would like to invite to the podium our dear friend, Dr. Auralia Garcia Dominic with Highmark.
All right, thank you, and good afternoon. Again, my name is Dr. Auralia Garcia Dominic, and I'm a behavioral scientist in health disparities research, and I hold the post as medical policy research analyst for Highmark. We are very excited to be with you today in partnership with Latino Connection, the Department of Health, and with you as the lead sponsor for this statewide CATE initiative, a COVID vaccine mobile unit that will travel across the Commonwealth of Pennsylvania. Through a series of educational and vaccine clinics and events, this mobile unit will help with COVID-19 equitable distribution for its vaccine in the Commonwealth. It will reach Pennsylvania's most vulnerable populations, including seniors and elderlies, racial and ethnic minorities and communities, LGBT communities, including individuals that are African American, Hispanic, Latinos, individuals that are Asian, Indian, Pacific Islanders, Native Alaskans, and it will also include individuals that live in rural areas as well as inner city and suburbs. The community-based program is an extension of the mobile unit that was launched earlier last year to bring bilingual COVID-19 disease prevention education, awareness, and testing to these communities. These combined mitigation efforts helped to flatten the curve last year in 2020. COVID-19 hospitalization data show that racial and ethnic minorities and in their communities, they are at increased risk for getting COVID, for spreading it, and dying of COVID. According to the CDC, African Americans and Hispanics are 3 times more likely to be hospitalized for COVID-19. To help reduce this disease risk and close persistent healthcare disparity gaps, addressing social determinants of health is needed, and removing modifiable risk factors are required. This will help ensure that everyone has a fair opportunity to be as healthy as possible. This vaccine mobile unit helps remove barriers such as language barriers, access barriers, and it does so for vulnerable populations and in the communities that they live in. A comprehensive approach inclusive of education, outreach, and collaboration with community partners like Latino Connection, the Department of Health, and providers like Penn State Health are key to successfully mitigating this pandemic. This is why, as part of our mission at Highmark, we are bringing care closer to home and reaching individuals where they live, where they work, where they worship and fellowship, and also where they play and go to school. I would also like to bring to your attention that this mobile unit will reach 66 counties in Pennsylvania, and it is designed for COVID-19 equitable distribution and to address any type of vaccine hesitancy and misinformation. Participants will have the opportunity to ask questions, to read about the vaccine in their preferred native language, and sign up to get vaccinated. At Highmark, we've been working very close to address and close persistent health disparities gaps throughout this pandemic by providing and hosting a numerous of clinics and events that provided testing last year. This year, we're providing access to COVID-19 vaccination. We have also taken very seriously the supply of COVID-19, and we have made sure that we have up to 20% of the supply being allocated to these vulnerable populations. We are very proud to continue these efforts by working with each of you in partnership, again, with the Latino Connection, the Department of Health, to get more shots in the arms. The Kate Mobile is coming to a community near you. And we look forward to sharing more about the impact of this initiative in the weeks to come. We encourage you to please talk to your doctors to learn of ways to reduce your COVID-19 risk and to get screened. Together, we can keep Pennsylvanians safe and healthy, and I thank you for all that you do to help mitigate these efforts. Thanks.
Good afternoon. I'm Reverend Dr. Lorena Marshall Blake from Independence Blue Cross Foundation. As president of the foundation, we are a proud partner with Latino Connection on Kate. I am so excited to be here to kick off the next phase for Kate, now reaching communities in need with COVID-19 vaccinations, in addition to the testing and education. Again, I applaud George of Latino Connection for leading and growing this initiative. And I recognize my colleagues at Highmark and my special friend from the Department of Health, Secretary Beam. This group is proof that it takes a public-private partnership to address the greatest health challenges facing our communities. And it is successful. I have had the privilege to travel throughout Philadelphia with Kate, partnering with local churches and other organizations to test residents in the community. So I know firsthand the great impact Kate has on the community. Kate is further delivering on its commitment to close the health inequity gap exacerbated by COVID-19. This next phase will not only increase access to vaccines in under-resourced communities, but it will also increase awareness and education about the safety and efficacy of the vaccine. It remains our priority to collaborate with Kate and other community-based organizations to improve equitable access to COVID testing, education, and vaccination. Again, thank you for allowing me to be here today.
Hola, buenas tardes. Hello, good afternoon, everyone. So I'm Dr. Sarah Aines Ramirez. I'm a family physician at Penn State Health Hershey Medical Center. Thank you for having me, everyone. I'm honored to be here to mark a day that will put wheels in motion to save countless lives. Today is not just about health or even science. It's about a focus on community and a commitment to breaking down any barriers that prevent access to essential care. Through my time serving as a clinician at Penn State Health, I have seen the destruction, fear, and devastation caused by disease. COVID-19 has been amongst the longest and hardest trials our nation has endured. It has damaged physical health, mental health, and our economy. 1 year ago, science was sprinting to learn all we could about the disease. And today, not only do we have vaccines, but we have outstanding initiatives like Kate to bring these vaccines to communities that are vulnerable and in such need. I can't overemphasize enough the importance of reaching vulnerable communities, especially with COVID-19 vaccination. There is evidence that shows that non-white populations have died from COVID-19 at a disproportionately higher rate than white populations in nearly every state. I know firsthand the barriers that exist for non-white and non-English speaking individuals. As a child, I had to help my mother navigate the healthcare system as her interpreter. I saw the struggles and the limitations and the difference in how she was treated solely because she could not understand the language. She did not speak English. I stand before you today representing the people, the communities that we need to reach. I work with these communities every day, and I can tell you that the barriers to adequate health care still exist. And there are patients out there, patients in our communities, just like my mother, just like myself, who struggle to find resources that they need because of the color of their skin or the language that they speak. Through Kate, we are accomplishing what I feel is most important, health initiative there is, removing the barriers in delivering health care in community-based settings, and providing these resources with bilingual, diverse individuals who represent the communities that we need to reach. We cannot expect people to find these resources. These resources must come to the people, and they must come in a way that is accessible, that is understood by the people. Latino Connection and all of its community partners who have made this initiative possible see the bigger picture. They see that the future of healthcare is accessibility. Any barrier, any limitation, any misconception can mean life or death for someone. And most often this occurs in our underserved communities. I'm so proud of the work that has been done to set KATE in motion. As the chairwoman of Latino Connection's Health Advisory Board, I have seen the hard work, the dedication, and the drive that has been brought to life through this initiative. This mobile unit is not just delivering vaccinations, it's delivering hope. It's delivering hope for better health, hope for longer lives, hope for the future of healthcare where resources are readily available and delivered within communities by people who represent diversity and inclusion. I want to emphasize what you have already heard today. Anyone who wants a COVID-19 vaccine should utilize any of the available resources like KATE to protect themselves and those who they love. Thank you so much to everyone for allowing me to be part of this powerful initiative and the health of our Commonwealth. Thank you. Muchas gracias.
Good afternoon. Buenas tardes.
Buenas tardes.
Buenas tardes. Buenas tardes. Today marks a monumental milestone for the Commonwealth of Pennsylvania. This is not just a day to announce that more people are eligible to receive a COVID vaccine. Today is about launching an important initiative that's aimed to bridge the gap in healthcare and now into our future. As we know, COVID-19 has disproportionately impacted our Latino and non-white communities. Throughout the pandemic, we have witnessed disparities in healthcare for our low-income and diverse neighborhoods. The spread of this disease has created great fear and anxieties in Latino families as we face language barriers, limited access to healthcare, and health information. Research indicates that 2/3 of Latino adults view COVID-19 as a major threat in their health, well as then half of the general public shares the same fears. Latino people also work in the front lines such as grocery stores, waste management, cleaning, sanitation services, and food delivery, just to name a few jobs, putting them at constant exposure to COVID-19, then returning home in living conditions that are often another great risk. 25% of Hispanic people live in multi-generational households, which make it challenging to take precautions to protect older family members or to isolate those who are sick in small living spaces. These individuals are the backbone of our society, yet they lack access to the most basic health care resources and education. But today, we put the wheels in motion to change that. Words cannot fully express how excited I am to see the launch of KATE Mobile Vaccination Unit. This initiative comes at critical time when many individuals are still struggling to receive the COVID-19 vaccination. Every effort to increase access to vaccination is worthy of recognition. And KATE's focus on helping to bring free and accessible vaccinations into the heart of the community needs the most deserving celebration. Reaching high vaccination rates across the Commonwealth is key to achieve broader population immunity. Through CATE, thousands of vaccinations will be provided over the coming months to move us closer in reaching this goal. As Executive Director to the Governor's Advisory Commission on Latino Affairs, I cannot overemphasize how this administration sprinted into immediate action when the pandemic hit. Our leaders worked around the clock to help mitigate and inform the public about this deadly disease. Through all of these efforts, we shall not lift our foot off the gas. Now remains a critical moment in time to stay on course and maintain precautions to mitigate the spread of COVID-19. As Secretary Beam mentioned earlier, getting vaccinated does not mean we can stop practicing other health safety efforts, like wearing your mask, washing your hands, and social distancing. It's merely one step we must take together to ensure the safe and healthy future for everyone within beyond Pennsylvania borders. I'm confident through the partnership with Latino Connections, the Department of Health, and the Governor's Advisory Commissions, we will accomplish vaccinating our most vulnerable populations. And that begins today with the launch of GATE. I am humbled to be a part of this critical initiative, and I'm so excited to see the health of our minority communities being made top priority in Pennsylvania. Lastly, I want to take this opportunity to thank Governor Wolf, Secretary Beam, and Latino Connections for the ongoing efforts on the fight against COVID-19. Thank you. Gracias.
Thank you so much, Luz, for your remarks on behalf of the governor. It's a pleasure to have you. Thank you so much, Lorena. Thank you so much, Dr. Sarah Ramirez. Thank you so much, Dr. Aralia, for being here. It's a pleasure to have all of you. At this time, myself and Secretary Beam are available for questions. Secretary Beam?
Sure. Hi.
Secretary, if you could tell me, because now that it seems as of tomorrow, everybody that wants the vaccine should be able to schedule one. How concerned are you about people who are going to choose not to? And what is the percentage number of people that you internally are saying, well, this is the percentage that's probably not going to get a vaccination? What would be success for you in terms of percentage or raw number?
Yeah. So to your first question, how concerned are we? We're incredibly concerned. I think that as we know, the supply has been our dilemma, this rollout thus far, and we're reaching a tipping point in Pennsylvania whereby the supply, while we still need more at this stage, it's going to require us being more convincing of folks. It's going to require educational efforts like the one that we're in today to allow folks to really address any of the hesitation they have to getting vaccinated. By way of what we're using for forecasts of hesitancy in population, our goal is really reaching the critical mass of roughly 80% of adults that would really be eligible for the vaccine in Pennsylvania to get vaccinated. Of course, we'd like every Pennsylvanian to get vaccinated, but I think that's where we felt like we have set a goal for ourselves to reach that 80%. And really we'll continue to adjust that and evaluate that as we have more campaigns to have adolescents vaccinated or have to go through a booster campaign or the like.
What does it mean to the rest of us or everybody else that's vaccinated to have a significant percentage of people not getting vaccinated?
Sure. So as we've said from the start, really this is a vaccination versus variance, right? And so even for those that have been vaccinated, the community still needs to make sure to protect ourselves and make sure that we can control against rising case counts, specifically of the variants where there's any sort of threat to having folks be overrunning hospitals or tragically having the deaths due to COVID-19. And so as a Commonwealth, we'll continuously be evaluating what our case counts are, hospitalizations, deaths, but really we're looking at what the variants are as they come into Pennsylvania, and we're trying to get as many folks vaccinated, just as you are, so we can actually have an offense against those variants as they creep into Pennsylvania.
Secretary Beam, as far as trust, outreach, and access are concerned, a lot of family doctors are still frustrated that they're sidelined and not giving first doses. And a lot of people are saying that if they could go to their family doctor, they feel a whole lot better about the process. What are you saying internally about getting them involved again?
So we are extremely eager to get not just primary care physicians, but other physicians that really folks are going to go to as their routine medical care. We want to get them vaccinations. And I really want to make sure that we emphasize, as we said from the get-go, Pennsylvania is very, very lucky in that we have 2,800 providers registered that have raised their hand and say, we want to be vaccinators. We know the urgency of this race has required us to narrow it down to that roughly 230. But as we get more supply and as we're able to watch that even those that are in the Focus Network may not be able to order as much because we still have that 80% over 7 days order in place, we'll be expanding who actually gets vaccine. And we really are eager to have folks be able to access the vaccine where it's probably most comfortable for them, which at times could be their primary care physician or the like.
I have to ask this question because I think I've asked it in every interview I've done with the Department of Health, but are we confident we're going to avoid what we saw in January and February with the vaccine appointment frustration?
Sure, and I'll allow the answer that I've probably responded with multiple times. We are in a different place than we were in January. So there's a few things that have changed. First, not only has supply increased, but we also have given those providers the ability to schedule out. They did not have that ability. They didn't have the predictability or the certainty that they required to be able to schedule an appointment even a week out, let alone a month out. And so now what we're doing is allowing folks to, again, being eligible means being able to go get an appointment scheduled. And I think it's a good tempering of expectations. It doesn't mean a shot in the arm today, but really what we're seeing is that providers are much more trusting and able to schedule out so folks know that when they become eligible, they get that date and time certain that they can get vaccinated.
Thank you.
Mm-hmm.
Secretary, I wanted to ask, I know in recent weeks, I think we've seen sort of an upward trend to a certain degree compared to where we were a few weeks ago. Do you have any information as to why that may be? And more importantly, even though more people are getting vaccinated, are you worried about the unvaccinated population as that trend continues, again, sort of a general upward compared to where we were weeks ago?
Sure. So specific to case counts and increasing case counts. So what we've seen is there is more travel taking place. So not just professional travel for work, but also folks are doing a bit more personal travel and the like. And when you have that travel and you have folks really going outside of their communities, you're going to see the transmission of disease also take place. So what we're watching is, again, as the variant, specifically the UK variant, comes with a little bit more higher propensity for being caught. It's a little bit more contagious. We're watching as those case counts increase. And I think more specifically what we're watching is the rate of case counts increasing. And while we're not at a plateau, we are reaching a bit of a plateau as to how quickly that rate was increasing.
State have to meet some kind of threshold or benchmark in order to start lifting restrictions as far as vaccination rates go?
So we first made our progress on April 4th to allow us to do an incremental step forward on the relaxation and mitigation efforts. Well, and we, again, as you all know, we typically wait 2 weeks to allow ourselves to understand any impact that would directly correlate or be caused by that relaxation and mitigation measures. We're 1 week into it. And I think what we're going to continue to do is make sure that, as our goal has always been, if we watch those hospitalizations increase, if we see any of those get to the point where we're having concern about hospitalizations being overrun, of course we'll be monitoring those mitigation efforts. But quite frankly, there is no just square threshold, because what we want to do is progress to the point where we don't have to have those mitigation efforts. But the greatest thing about and the greatest thing that anyone can do to really get us there is keep doing what we've been asking, which is the masking, the social distancing, and the like. And that's going to be how we progress to getting our communities safe without needing mitigation efforts enforced by state government.
Just can you articulate why the state jumped past 1C to immediately open it up to everyone?
Sure. So starting roughly last week, we continued to hear that providers were having a lot of difficulty scheduling appointments. And throughout this entire rollout, we've stuck to the principle of no wasted dose, right? And so providers would call concerned that they couldn't fulfill appointments, and while we still have an order in place that they have to use 80% of the vaccine that they receive in 7 days. And so as we continue to hear that, and most importantly, we heard it from regions across the state. This wasn't just from one localized area. We realized that the need to keep the demand at its highest propensity possible was incredibly important. And so that's why we progressed to phase 2 to allow us to, again, sustain that demand, which can keep the pace of the vaccinations up.
Secretary, I just spoke with a gentleman over here who said he got a shot, but some of his neighbors and friends over here just don't trust it. What do you say to those folks?
So really, the safety and the efficacy of this vaccine is not just something that I can convey, but what I would love to convey is from his perspective of just getting vaccinated. We as state government will, of course, continue to use our voices to emphasize that these vaccines were founded with good science, they are safe, and they are effective. But more than anything, we also know that it's going to take the community discussing how folks post-vaccine are safely and effectively going back to being able to be in those small gatherings and the like, that we really think will allow folks to reach that point of feeling comfortable with getting vaccinated themselves.
Thank you.
George, I was going to ask you a question.
It's hard to follow Secretary Beam, but I'll try.
I'm sure you'll do great. Can you talk about messaging in the Latino community and some of the underserved communities? I know that has been an issue throughout the pandemic, but do you think we're in a better place, and are you feeling confident that units like this can reach the demographic that you wish to target?
We are feeling extremely confident. Thank you so much for the great question. We feel extremely confident that this type of initiative is going to be successful in reaching communities that have been feeling not at ease for quite some time. When you present people the access and the opportunity of meeting people where they are, where they feel most comfortable, the success is phenomenal. It's actually a part of one of the foundations of social determinants of health, which is to meet people where they are. And Dr. Lorena Marshall Blake herself from Independence Blue Cross Foundation has been a volunteer at many of our events in the past few months, working with churches and food banks and community-based organizations. And the lines of people that have started prior to the mobile unit even arriving, the questions that they feel most comfortable asking when it's someone that looks like them, someone that can speak their native language, is phenomenal. My mother is non-English speaking. She's here today, by the way, and she didn't feel comfortable getting her vaccine. And when I was able to connect her to her doctor to answer questions, that was one step forward for her to get her vaccine. Like Secretary Beam said, seeing behind us and to our right, which we're going to keep off camera just to keep their privacy, it's a humanizing process to see people of color today, to see communities of color, communities that have for quite some time not been able to access the vaccine to be here today. So we're really excited to get Kate on the road and get those reels running. We will be administering a little over approximately 3,000 or so vaccines this week alone. So we're really looking forward to getting this mobile unit on the road and reaching those communities that for quite some time have been uncomfortable, but are ready and have called and have emailed, and we're really excited to be working with community-based organizations to make this possible.
Do you think universal eligibility was the key to moving forward with something like this in areas where people have communal living and then obviously an urban environment?
Absolutely. I truly believe that. Here in just a few minutes, I'm going to ask Dr. Ramirez to start getting ready. Dr. Ramirez, if you can come behind me, and Luz, you two as well. We're actually going to be administering a vaccine here. Luz Colon from the governor's office was not 100% sure if, which vaccine she wanted to get. So finally she made that decision, and she's giving us the honor of doing it here today. And Dr. Ramirez from Penn State will be administering the vaccine. I'm really proud of the leadership that the Department of Health has to offer, and Secretary Beam and Governor Wolf for taking the steps they have taken to open up vaccine eligibility a lot sooner than expected. Because of those efforts, we expect to be able to reach larger numbers of communities, members that were not yet ready or were not yet sure. Simultaneously, as we are doing these COVID vaccination mobile events, we will also be doing a total number of 100 table pop-up events at local everyday retail shops, bodegas, corner stores, hair salons, barber shops, and so forth. And those events will be used to provide education and to help share facts to erase fear around COVID-19 and help get those vaccinations into people's arms. So, thank you. Dr. Ramirez, if you want to get ready to administer the vaccine here, I'll take your folder. It's really phenomenal that we have a member of leadership of the Hispanic community, willing to do this on camera, not only to help educate others, but to essentially be the example, ser el ejemplo para nuestra comunidad, que es importante recibir la vacuna. Estamos súper agradecidos de que la doctora Ramírez diga que sí para hacer esto. Y Luz, estamos súper contentos que tú eres un ejemplo para nuestra comunidad. Para nosotros es un honor. So, we're really excited to be launching this initiative. And again, thank you so much, Secretary Beam, for making this possible. And another big thank you to our friends at the Beacon Clinic and to our friends at Highmark and Independence Blue Cross. Dr. Ramirez needs another pair of gloves for getting that for you at this time. Were the gloves really small?
Well, you should have put them on after you put gel on.
Okay.
Excellent. I did that on purpose so I can wear these. Here we go. I like to get everything ready.
Luz, are your kids watching this?
No. Thankfully, they're in school.
Well, tomorrow they'll be able to tell their classmates, my mom got vaccinated on TV.
Okay, Luz.
Okay, here we go.
Where you want it?
Yes, I am positive. I am positive.
1, 2, go for it.
Thank you. Yes, this is about keeping each other safe. Keeping healthy.
Done.
Thank you.
Give it up for Luz, everybody. Woo! If there are no additional questions from the press at this time, again, on behalf of Latino Connection and our amazing award-winning team, we are just humbled for the partnership. Thank you again, Secretary Beam, for getting us this opportunity to get out into our communities. Thank you again. Have a beautiful day. Gracias.
Hola Pennsylvania, mi nombre es Giselle Barreto Ferman y yo soy su segunda dama. Las vacunas contra